huge over to my channel of an everyday life of an Aspie. If you're new to my channel, I'm AspieAnswersAll, or Aspie as I'm clinically known for short for most people who have been travelling with me and journeying with me from the very beginning. I'm all about creating a mental health and awareness versus sharing my life stories, as well as basically of my ups and downs and all that, just to cover the basis of my journey with Asperger's syndrome, depression, OCD, anxiety and the like, so that you guys can have a lowdown of what my life is really like as a person underneath these diagnoses, and hopefully get to know me more of a person than just these diagnoses, so to speak. I'm at the stage now that basically I'm also trying to collab or get together or research some more information into some of the topics that I feel to share with you all, which is those speeches and series, as well as the dyslexia series. And it has come to my halt now that basically at this point of time today, or just yesterday, basically I just received a message from somebody on YouTube that they wanted me to talk of another disorder that they have, or those actually suffer from, basically based on the everyday occurrences in their life. So those ones are also called excoriation disorder. Basically covered in that topic, you know, what's the cause of the triggers, basically the signs and symptoms to look out for, as well as basically just a little brief overview why I do it, sort of thing, because obviously, as I said before, that sometimes with some people with Asperger's syndrome there are certain basically repetitive behaviours and stereotypical behaviours that is involved and entailed in certain situations that may arise, no matter what it may be, you know, that cause them to be stressed, anxious and the works. So in all further ado, basically guys, I'm going to talk about basically skin picking. Basically this is a lead on to the hair pulling of Asperger's syndrome and hair pulling. But bear in mind though, with some of the topics, this can be entailing just not people with Asperger's syndrome, but people in the group that I've targeted here is like with the certain mental health disorders that does actually come into play with certain, you know, everyday conditions that I'm sharing, be it for that classic example, as I've just mentioned briefly, the hair pulling sort of thing. So and further ado guys, basically let's begin this before I run out of time. So as you know, basically with this in mind though, like as I said before, for the one of the hair pulling, when it comes down to coincide with this excoriation disorder, get my name right, or they're known as basically dermatillomania, skin picking disorder, neurotic, excoriation, acne, excoriee, pathologic skin picking, PSP, abbreviated down to compulsive skin picking, CSP, or psychogenic excoriation. Like I said, is a form of a mental disorder characterized by the repeated urge to pick at one's own skin, often to the extent to that tissue damage is done to the tissue when they rupture and bleed, to the point of obviously, you know, picking layers and layers of their tissue and the skin. Obviously, as I said before, this can be like a sign of many things, as well as basically bearing in mind, like I said, especially for sometimes with autistics and people with mental health disorders, basically this is just like a form of repetitive behaviour, stereotypic behaviours commonly seen with people with mental health disorders, as well as people with the AS most likely. But then again, you got to bear in mind though, however, you know, as I said before, that, you know, there are various reasons to why this is happening, and this is going to cover that really soon as I'm sharing this with you all today. So basically with the classification, since the DSM-5 manual that has been brought out in 2013, they reckon or seem to claim that excoriation disorder is classified as L98.1, which is the skin picking disorder, and ICD-10, and is no longer classified as a impulse control disorder, because once upon a time obviously it's all about, you know, having no control over themselves when it came down to skin picking, and then many has tend to believe that there's no, you know, cure or treatments available for this. But let's be real, that there is ways to go about with everything that we go through of these mental health issues versus all these other issues that come psychologically versus mentally and all the like. But then again, also with this excoriation disorder, this is defined as I said, repetitive and compulsive kind of picking of the skin that results in that tissue damage, whatever it may be. So it's not an its most official name has been called dermatillomania for some time, as from the release of the Diagnostic and Statistical Manual of Mental Disorders that was released of the 5th edition in May 2013. This has been classified as a separate own condition now under obsessive compulsive and related disorders, or OCRD, and is termed excoriation picking disorder. Okay, there's similarities with these other conditions that is entailed with the skin picking. Basically, obviously, as the inability to control the urge to pick is similar to the urge of compulsively pulling one hair, as I've shared with you briefly, of the trichomania. Excuse my terminology, I'm trying to get all these clinical terms out for you, even though I get tongue-tied. Humbly apologise, but hopefully as you're following me along that you'll be able to understand what I'm saying. But researchers have noted and claimed that for these following situations of these similarities between the hair pulling and actually the skin picking, the symptoms are ritualistic, but there are no preceding obsessions in the both, but there has been some similar triggers for the compulsive actions. Both conditions appear to play a role in modifying the arousal level of the subject, and the age of the onset for both conditions is kind of similar. There is also a high level of comorbidity between those that have the hair pulling disorder and those that has the skin disorder. A notable difference though, however, between these conditions is that skin picking seems to be dominated by females, whereas trichomania is more evenly distributed across both genders. Researchers also suggested that this disorder may be thought as of a type of obsessive compulsive disorder, OCD, and with this entailing basically of the skin picking disorder versus the OCD, they are kind of similar in that they both involve repetitive engagement and behaviours with diminished control, and both generally do decrease the anxiety sort of thing, even though sometimes some people will call this another form of self-harm. Some may call it a release for them, for the skin picking. Some of the people are the reasonings behind this, besides the self-harm and the release of pain or the release of just maybe pleasure or arousal or whatever it may be. Basically they have their own reasons, and sometimes what we go through in our life can actually counterfeit for these mental health problems that does exist today. Anyway, continuing on, nevertheless, from what I studied from Odlug and Grant have suggested that excoriation disorder is more akin to substance abuse disorder than OCD. They argue that excoriation disorder differs from OCD in the following fundamental ways. So bear in mind of this is number one, there is much greater chance or share of females with excoriation disorder. Number two, excoriation disorder may be inherently pleasurable, whereas OCD is not. 3, the treatments that are generally effective for patients with OCD, i.e. for example, your SSRIs and exposure therapy, are not as successful in patients with this disorder. And number 4, unlike OCD, picking the skin is really down to basically, driven by obsessive thoughts. Odlug and Grant have recognised the following similarity between individuals with dermatillomania and patients with these addictions as number 1, a compulsion to engage in the negative behaviour despite the knowledge of harm. 2, a lack of control over the problematic behaviour. Number 3, a strong urge to engage in the behaviour prior to engagement. And 4, a feeling of pleasure while engaging in the behaviour, or a feeling of relief or reduced anxiety after engaging in the behaviour. One study has supported that addiction theory of picking found that 79% of patients that has this sort of reported a pleasurable feeling when picking, however. Another argument has been said by these researchers that I've researched up, Odlug and Grant, argued the fact that dermatillomania could have several different psychological causes, which could explain why some patients may seem to more likely have these symptoms of OCD and other forms of addiction. They suggest that treating certain cases of this as an addiction may yield more success than just treating these as a form of OCD, as again, as I said, that they treat this as a separate kind of disorder. Okay, the signs and symptoms that I'm addressing to you all. Basically, there are episodes of skin picking that are often preceded or accompanied by tension, anxiety or stress, as I mentioned briefly. During these moments of the time of tension, anxiety or stress, there is commonly a compulsive urge to pick, squeeze or scratch at a surface or region of the body, often the location of that perceived skin defect, regardless where it is, so they can make it look perfect and whatnot. The region most commonly picked in the face, but other frequent locations include the arms, legs, back, gums, neck, shoulders, scalp, abdomen, chest, and extremities such as the fingernails, cuticles, and toenails. Most patients with this disorder report having a area to heal. Individuals with this disorder may vary in their picking behaviour. Some do it briefly multiple times a day, where others can do it one picking session that can last for hours on end. The most common way to pick is to use the fingers, although a significant minority may use certain tools such as tweezers or needles or some form of tool that is sharp, and as I said, that will lead to them to self-harm and maybe do more damage in the tissue lining of their skin versus their arteries and whatnot, depending how severe it can go for them. Complications that arises from this disorder may include infection at the site of picking, again, tissue damage, and number 3, septicemia. Damage from picking can be severe as to require skin grafting as a form of treatment. Severe picking can cause also epidural abscesses. Severe cases of excoriation can cause life-threatening injuries. For example, one reported case, a female picked a hole through the bridge of her nose, which then required surgery to fix the nose. And then another classic case that has been shared out of this report has shown about a 40-year-old female picked through the skin on her neck, exposing the carotid artery. Pain in the neck or back can arise due to prolonged bent over positions while engaging in this behaviour. Besides physical injuries, this disorder can cause severe physical scarring and disfigurement. This disorder also can cause feeling of intense helplessness, guilt, shame and embarrassment in some cases for the individuals, whoever it may be, basically, and this can greatly increase the risk of, basically, as I shared, self-harm. Studies have shown that this disorder of the skin picking can be presented as suicidal ideation, and about 12% of individuals with this condition. Suicide attempts in 11.5% of the individuals with this condition, and psychiatric hospitalizations obviously is 15% of individuals. Some of the causes, like I said, can vary from person to person regardless, even though there has been many different theories in regarding to the causes of this kind of disorder, which can include biological and obviously environmental factors. Not always the case, but then again, like I said, it can depend on the everyday individual of maybe what they have been through. May it be abuse from their partner, be it, mental state of mind, how they are with their mental state, of the mental abuse versus the physical, or they may have been sexually abused, like again, a form of drug addiction maybe that has caused them to reach out to this point of skin picking. A common hypothesis is that this disorder is often a coping mechanism. Some have to deal with elevated levels of turmoil and arousal or stress, depending again with the individual of themselves. An individual has an independent stress response, or ISR as I call it, for abbreviated down to in the clinical terms. A review of some behavioural studies has found support in this hypothesis in that skin picking appears to be maintained by automatic reinforcement within this individual, in contrast to neurological theories. There are some psychologists who believe that picking behavior can result of repressed rage felt toward authorization of parents. Similar theory holds that overbearing parents can cause the behavior to develop in children and then continue on until adulthood. In the neurological side of things, though, there has been limited knowledge regarding the neurobiology that drives this disorder, and there have been no neuroimaging studies of patients with this form of disorder. Those individuals that has this disorder, along with other diagnosed conditions, report different motivations for their picking, as I shared so many times before. Sometimes some with both OCD and this disorder report that they will pick their skin due to a perceived contamination of the skin, while those with other, body dysmorphic kind of disorder, BDD, or this disorder reportedly to fix perceived imperfections in their skin. Studies has also shown a linkage between some form of, chemical drugs like your dopamine or your hormones, and they feel the urge to pick through, between the dopamine and the urge to pick. Also some form of drugs such as your cocaine, methamphetamine are the most common ones, which are obviously dopamine antagonists, which obviously fights away from what the drug is supposed to be doing with your hormones, but I'll share more later of the pharmaceutical effects on these drugs if you want me to, which increase the obviously pharmacological effects of the dopamine, which has been shown to cause uncontrollable picking in many users that, they use the form of drugs, regardless of what it may be. These drugs can create the sensation of formication, which feels like something is crawling under their skin. They feel itchy, it's like, something's under the skin. Or some say that even though there's something under the skin, it feels like, ants crawling all over them, or something like spider legs crawling up their legs and arms and every other area that desires them to want to really, really itch. Sometimes this comes from a form of addiction too, with certain people that are high on drugs, that it causes them to itch and, tend to think that there's something wrong with their, skin and stuff. Additionally, drugs such as, as I may have mentioned before, not sure, naltrexone have shown some benefit in reducing picking behaviour. Thus, the excoriation disorder could result from a dysfunction to the dopamine reward functions inside the body. There may be other neurological explanation for these disorders. Individuals with conditions have less motor inhibitor control, but show no signs of difference in the cognitive flexibility when compared to individuals without the condition. Motor inhibitor control is a function of the right lateralized frontal circuit, which includes the right inferior frontal and bilateral cortices. Impairment of motor inhibitor control, I'm meaning here, is kind of similar to the neurological conditions of those who have problems suppressing inappropriate behaviours, such as abusing some form of drugs like your common one, methamphetamine. Diagnosis of this. There has been controversy over the creation of a separate category in DSM-5 manual, as I've shared, for excoriation or skin picking disorder. Two of the main reasons for this is for objecting to the inclusion of excoriation in DSM are: number one, this disorder may be just a sign or a symptom of a different underlying disorder, e.g. OCD or BDD. And number two, excoriation disorder is merely a bad habit, and that by allowing this disorder is to obtain its own separate category, it would force the DSM manual to include a wide array of bad habits as separate syndromes, e.g. for example nail biting or nose picking. Stein has argued that, however, this disorder does qualify as a separate syndrome and should be classified as its own category because, number one, this disorder obviously occurs as the primary disorder and not as a subset of a larger disorder. Number two, however, this disorder of the skin disorder has well been defined clinical features. Number three, there has been gathering of data on the clinical features and diagnostic criteria for the condition. Number four, there is sufficient data to create this as a separate category for excoriation. Number five, the descent rate for excoriation disorder is high within the population. And number six, I should say, diagnostic criteria for the disease has already been proposed, as just said previously, with those two, like your OCD and BDD. And number seven, the classification of excoriation disorder as a separate condition would lead to better studies and better treatment outcomes, as well as number eight, classification as a separate condition would lead to more awareness of this disorder and encourage more people to obtain the right treatment for them. Because of this disorder, however, is different from other conditions and disorders that cause picking of the skin, it is important that any diagnosis, however, of excoriation disorder take into account various other medical conditions as possible causes before diagnosing the patient with excoriation disorder. Because as I said before, so many times before, I can't stress it enough, that every condition will have another underlying symptoms or thing. That's why there needs to be some form of other treatments along the way, be it whatever it may be it a mental health kind of condition versus your psychological versus your physical condition, or whatever that may be. There are a variety of conditions that can cause the itching and skin picking, okay, and you may have heard of them, which are your eczema, psoriasis, diabetes, liver disease, Hodgkin's disease, polycythemia vera, systemic lupus, and Prader-Willi syndrome. In order to better understand this disorder, researchers have developed a variety of scales to categorize skin picking behavior. These include the skin picking impact scale, which is the SPIS, and the Miller-Quay inventory of the dimensions of adult skin picking. The SPIS was created to measure how skin picking affects the individual socially, behaviourally, and emotionally. Its release of that Diagnostic Manual, Statistical Mental Disorders in May 2013 of the 5th edition. This disorder is classified as its own separate condition under obsessive compulsive and related disorder, or as I said, OCRD, and is termed excoriation skin picking disorder. There are a variety of treatments of basically how to manage this disorder, but basically you got to bear in mind though, first and foremost is the knowledge of knowing what's effective for those treatments of certain disorders, be it whatever it is. In this case, with this one, knowledge about the effectiveness of these treatments for this excoriation disorder is sparse. Despite the prevalence of the condition, there are two major classes of therapy, basically, which is the pharmacological and the behavioural, as mentioned. Individuals with these disorders don't often seek treatment for the condition, largely due to feelings of embarrassment, alienation, lack of awareness, or belief that they may have the condition, and this condition may not be treated like every other classic causes of every other conditions. Okay, medication, however, there are several different classes of pharmacological treatment agents that can support for treating this disorder. Number 1 is your SSRIs, number 2, opioid antagonists, and number 3, your glutamatergic agents. In addition to these classes of drugs, some other pharmacological products have been tested in small trials and as well, though. However, your SSRIs have shown to be effective in the treatment of OCD, and this has been provided an argument in favour of treating this disorder with the same therapy. Unfortunately, there has been some clinical studies that hasn't provided enough clear support for this. Because there has not been large double-blind placebo-controlled trials of the SSRI therapy for this disorder, however, review of treatment with this SSRIs have shown that the following may be effective in reduced picking behaviour. So you've got certain like SSRI kind of, medications, be it your doxepine, your clomipramine, naltrexone, pimozide, and olanzapine. Small studies of fluoxetine and SSRI in treating excoriation disorder showing that drug reduced certain aspects of skin picking as compared to placebo, but full remission was not observed. One small study of patients with this disorder treated with citalopram and other SSRIs showed that those that took the drug significantly reduced their scores on the Brown compulsive scale compared to the placebo, but there has not been no significant decrease on the visual analog skin picking. Okay, another one form of treatment you can look at is counselling. Some behavioural treatments include habit reversal training and your CBT, acceptance enhanced behaviour therapy, or AEBT as I call it for short, and your acceptance and commitment therapy, your ACT. Several studies have shown that habit reversal training associated with the awareness training reduces the skin picking disorder in those individuals with this disorder that do not have psychological disabilities. Habit reversal training can include awareness enhancement and completing some response training. For example, on Wednesday, the competing response training required participants to make a closed fist for 1 minute instead of picking in response for the condition that usually provokes that kind of behaviour of picking. Developmentally disabled. There has been several different behavioural intentions or interventions, shall I say, that have been tested to treat excoriation disorder and the developmental disorder. But one method has been shown is to have individuals wear formal protective clothing that limits the ability of the patient to pick at his or her own body. Example, maybe they could wear gloves, or they could wear a facial mask. Another behaviour treatments attempt to change this behaviour through providing different incentives, using maybe under the differential reinforcement of behaviour, other behaviour, DRO, abbreviated down to. A patient is rewarded if able to abstain from the picking behaviour for a certain amount of time. In contrast to the DRO, however, differential reinforcement of committed behaviour, DRI, was an individual for engaging in a behaviour that cannot physically occur at the same time as the problem behaviour occurs, e.g. sitting on your hands instead of picking at your skin. Lastly, differential reinforcement of alternate behaviour rewards behaviour that is not necessarily incompatible with the target behaviour but serves the same function as the target behaviour. Example here is providing people with competing behaviour to occupy in their time of skin picking. All these techniques have been reported to have some success in small studies, but it has been known to test in the large enough population to provide definitive evidence of this effectiveness. Prognosis, however. Typically, individuals with this disorder may find that the disorder interferes with their daily life, hindering them by shame, embarrassment, and humiliation. They take measures to hide themselves as well as their disorder by not leaving home, wearing long sleeves and pants, even in really hot climates or temperatures stage in the summer, be it whatever it may be, for example, or covering their visible damage to skin with cosmetics and or bandages. Activities such as typing may be painful for those who pick at fingers or hands, or walking for those who may pick at the soles of the feet, basically does create a bit of pain. Okay, basically for now that ends basically the disorder that I'm talking about of your excoriation disorder. Feel free to give me a like for thumbs up for support and engagement. Feel free to comment below that maybe what I may have missed that you feel is relevant for you, to maybe the reasons and causes for you to do what I'm sharing with you. I humble apologise if it's not the kind of topic that you want to share on that, but like I said so many times before, with certain topics I want to actually hopefully share an awareness and understanding for everyone, so that hopefully that we can just remove the stereotyping, as I said so many times before, my mental health sort of videos, as well as just basically hoping that people can understand and we can get together and support one another regardless of our differences and matters of opinion, respecting one another regardless what it may be, so that hopefully we can feel safe and not feel like we're being judged, misread, and the like of everything else that goes on with it. So no further ado, guys, basically thanks for your support, thanks for watching. Basically do what you love what you do, subscribe to my channel if you haven't done so, keep an eye out for me, even though I may not be around as much as I was hoping, basically because, as I said, my situation has changed, because obviously I might have to, for my upload schedule might have to be, changed again, but I'll keep you all posted regardless, and hopefully that you can forgive me on that front, because yes, we know that everybody's kind of schedule has to change one way or another to best fit them and whatnot. But in all further ado, guys, private message me, basically if you feel the need to, either on AspieAnswersAll or even just direct message me on YouTube. Just don't be afraid that don't fret for it forever, whatever reason it may be, because obviously I will be around answering to your questions, or maybe answering to your emails before I do decide to hopefully come up with a topic that I feel is relevant and close to my heart to share, regardless of what it may be. Feel free to share these channels around, basically, to your family and friends, and follow me on Twitter. So no further ado, guys, thanks for your support, thanks for watching, and I'll see you all again soon.